So, shockwave therapy or platelet rich plasma for erectile dysfunction, which one is best? Shockwave therapy, often known as Gainswave, especially in the United States, and platelet rich plasma, most commonly known under the trademark P-Shot, both are marketed to tell you that it can reverse and treat erectile dysfunction. But which one do you want to spend your hard-earned money on? I am Dr. Simon Snook. I'm a sexual and reproductive health specialist, and this channel is the Kiwi Sex Doctor, where I like to give you tips, tricks, and hacks for a better sex life. So right about now, you should be seeing some links to some other videos I've done, one on shockwave therapy and whether it works and how it works, a much more in-depth look at that, and the same on the P-Shot. What I want to talk about here is a sort of a head-to-head comparison between them, because they both intend to do the same thing, that is lead to regeneration of blood vessels in the penis, therefore helping the body deliver more blood to the penis, and of course more blood means a more erect penis. They use very different ways of doing it. The shockwave therapy essentially does exactly what the term says. It delivers shock waves or energy into the penile tissue, causing microscopic damage to the tissue, which then leads to the body wanting to heal that area, and in the healing process new blood vessels are formed. Platelet rich plasma takes some blood from the person, does some clever things with it to release healing chemicals that the body naturally produces, and injects it into the penis again to enhance or to cause healing in that area and new vessel formation. So which one is best? So probably most importantly, shockwave therapy does have a lot of proof that it works. There are many medical studies over a number of years now that have repeatedly showed that no matter which type of machine you use to deliver the shockwave, how often you do it, what energy levels you use, where exactly you deliver the shockwaves, they all work. No one knows which one's really the best, but we certainly know that it works. Platelet rich plasma, however, doesn't have that medical evidence, and to date I think we still have to call it an experimental treatment. Now there are a number of studies that show us things that are encouraging. We can certainly see in animals that you can see new blood vessel formation after using platelet rich plasma, and there has been fairly recently a study, albeit small and with a few flaws in it, but that certainly showed an improvement with platelet rich plasma, and with time I would hope that a larger study, better designed, could certainly confirm that, and we could then say that platelet rich plasma works. But at the moment we have to still call it an experimental treatment, and we cannot categorically as clinicians say to our patient this will work for you. So shockwave therapy proven, platelet rich plasma hopeful but not proven. That's a big one up for shockwave therapy. Number two, the shockwave therapy is something that is only mildly uncomfortable when you're receiving it, and certainly during that treatment session, which takes 20 to 30 minutes, the discomfort usually goes away and it's very, very well tolerated. You walk out feeling fine. Platelet rich plasma, however, you've got to have blood taken from you, and more importantly, injections back into the penis. Now, these can be delivered using very clever local anesthetic creams that virtually numb the penis, but nonetheless, that is a treatment that is maybe less well appreciated by men than having a shockwave delivered. So in terms of receiving and how it feels, that's point number 2 to shockwave, 0 to platelet rich plasma. So what about price? Well, again, you may see great variation in price here. I talked at the beginning about the fact that a number of people using the shockwave therapy deliver something called Gainswave, which is a specific protocol, and it's a trademark, and often that is potentially more expensive than someone using a generic protocol and not advertising under the Gainswave umbrella. Equally, platelet rich plasma is trademarked for a number of people under a certain protocol called the P-Shot, and again, because of the trademark and the marketing that goes into the P-Shot, that can be more expensive than generic platelet rich plasma. So there are lots of variation in costs out there, but beware, the costs are often quoted per treatment, and this is where there is maybe something to pick up on. That P-Shot is usually advised as a single treatment for the full effect, whereas shockwave therapy is often delivered a number of times, and it appears to be the more times you deliver it over different days rather than necessary shocks during a treatment, the more effective it is. So the price for a single shockwave versus the price of a platelet rich plasma may be much cheaper, but as the time you start to add up the repeated shock waves, you may start to get even above the price of platelet rich plasma. So for the case of making this a more exciting match, we'll give 1 point to the platelet rich plasma, making it 2-1. So we're coming to the end of the match, 2-1 currently to the shockwave therapy. What about how long it lasts? Well, as I said, we can't have any necessary proof on the P shot, but essentially because they both lead to tissue regeneration, they should cause that regeneration which will last for quite some time, but obviously with time you continue to age and the blood vessels continue to age and you may require repeat treatment, and neither one necessarily has any reason why it should last longer than the other, so we're going to give that an equal score, making the final score 3-2 to Gainswave or shockwave therapy over platelet rich plasma or the P shot. But before you then throw the P shot and platelet rich plasma in the bin, let's just look at one other thing. The fact is that you can combine the two of them. That is depending, of course, on how deep your pockets are. Both of these treatments can be quite expensive. And there is no evidence necessarily for the value of combining them, but it does make a certain amount of sense that if you are delivering shock waves causing microscopic damage to the penis and at the same time delivering the healing message through platelet-rich plasma, you can boost or amplify the healing and get a combined effect causing greater improvement. So given that neither of these treatments, apart from the financial costs, have any significant detriments to you and certainly don't cause anything in the terms of long-term side effects or damage to the penis, if you've got deep enough pockets, my suggestion would be combine the two and give yourself the best chance of improvement in erectile function. So I hope this has been helpful to you today. Please do give me a like, please subscribe to my channel. There are lots of other videos on here looking at ways of improving erectile function and all other aspects of sexual dysfunction. Please also do leave me some comments. Always try to reply to them if I can, and indeed please do ask me if you have any particular subjects you'd like me to cover in these videos. This group that I've been doing about shockwave therapy is in response to a comment left asking me about whether shockwave therapy is better than platelet-rich plasma, and that's why we've done this video today. So your comments are always really welcomed and listened to. Thank you very much for watching and take care of yourselves.